Hello, everybody. This is Gary. Today is Tuesday, February 21st, 2023. It's 3:29 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today I'm doing okay. My paranoia levels are not that high. At least they don't feel that high. My delusions don't seem to be that strong today. My auditory hallucinations are at a bare minimum. My depression's not that severe. My anxiety levels are not that bad. I didn't go out today to do my physical therapy exercises and walking. Um, I probably won't. I just feel lazy today. Um, but my psychiatric symptoms today don't seem to be that severe. Um, I still use the Klonopin for anxiety 3 times a day, and I meditate each time I take the Klonopin. And 2 times out of those 3 times that I take the Klonopin, I'm also allowed to take 5 milligrams of Zyprexa twice a day. Um, it helps with paranoia, delusions, auditory hallucinations, as well as the anxiety when I take the Zyprexa and the Klonopin together. The Klonopin itself is for anxiety. If I was taking it because of psychotic symptoms, it would be pretty much be useless in that arena because it's an anti-anxiety drug. It's not an antipsychotic. That's why sometimes I take the Zyprexa with the Klonopin because the paranoia, delusions, auditory hallucinations, and anxiety are happening at the same time. I'm an atheist, so my meditation has nothing to do with anything spiritual, religious, supernatural, magical, or anything like that. Um, I'm an atheist in the most extreme sense. I believe in nothing supernatural, whether that's God, angels, spirits, demons, souls, magic, miracles, chakras, out of body experiences. I just don't believe in anything supernatural. Um, because I found as a person who has delusions and paranoia sometimes, religious ideas only feel that, for me at least. When I was a religious person, I got caught up in religious delusions, religious hallucinations, and I found it necessary to separate myself completely from the idea that there's anything that supernaturally exists. My voices are not demons, they're not spirits, they're not anything like that. They're a biological part of my brain not functioning correctly. Um, so there's nothing supernatural about my hallucinations, although people have left comments saying it's demons and I need to pray to Jesus or Buddha or whoever. That's all nonsense. Um, I'm seeing my peer support specialist day after tomorrow. That is somebody with a mental health diagnosis who works as a counselor on staff at my clinic. Next week, I'm seeing my regular psychotherapist, and the week after that, I'll be seeing my psychiatrist. Um, I doubt we'll change anything in my meds. Um, each time we try to increase the Zyprexa, I get urinary retention, which can be a medical emergency, and then I have to go to the emergency room and have a urinary catheter inserted, and then I have to wait 2 weeks for an appointment with the urologist to pull it out. So we're not raising the Zyprexa. We've gone as high as we can with that. I mean, I take a lot of medications. There's a lot of side effects, and one of the most inconvenient was urinary retention. Although I did have surgery for urinary retention, that was a separate cause. I had bladder problems, and I needed surgery on my bladder. And they also gave me prostate surgery for difficulty urinating. They didn't remove my prostate completely, they just trimmed it down to make it easier for urine to flow. Um, but yeah, there's a lot of side effects from medications. I take Seroquel. My weight has gone up by 30 pounds. Seroquel has a tendency to shut off that part of the brain that tells you you're full when you're eating, so you just keep eating. And I'm pre-diabetic and I have high cholesterol, and my primary care doctor wants me to lower my blood sugar and lower my cholesterol, but through diet, not through drugs. I'm already on a lot of drugs for medical and psychiatric reasons, um, but my primary care provider wants me to practice eating a better diet to bring down my sugar levels, um, and to bring down my cholesterol, because obviously both of those can be controlled by diet, and I do have the power to control my diet regardless of the cerebral, because I've done it before. So I'm about 30 pounds overweight and I need to lose that weight. I still have pulmonary fibrosis. That's a relatively new diagnosis. What that is there's scar tissue in my lungs that makes it more difficult to breathe. We're not sure what's forming the scar tissue. We do know that it's there. We don't know if it's going to advance. It's not cancer. It doesn't spread like cancer. That's not what causes it to spread. Um, the scar tissue develops in the lung set or the air sacs of the lungs, making it difficult for the lungs to exchange oxygen and carbon dioxide with each other. Um, so I get shortness of breath very easily, even if I'm just going out for a walk. It doesn't even have to be a strenuous walk. I do have a specialist appointment with a pulmonary specialist on March 28th. They will run some tests on my lungs, and then I will talk to the doctor right after that. So I have two separate appointments on the same day. One at 9:30 for testing my lungs, and then at 10 a.m. with the doctor, who's the pulmonary specialist. And I'll know more then. Right now, I don't know that much. Can't say much about it right now. But I definitely get shortness of breath very easily. But there's nothing else to report on right now. Comment, share, and like.